When people think of a stroke, they usually imagine sudden and dramatic symptoms, slurred speech, a drooping face, or paralysis on one side of the body. These are indeed major warning signs. But the body often whispers long before it screams. One of the earliest places where the body whispers about a stroke is the legs. The problem is that most people overlook these signs, misinterpret them, or rationalize them as signs of aging, fatigue, or lack of exercise. A stroke does not happen overnight. It is the result of years, sometimes decades, of blood vessels slowly narrowing, circulation weakening, and the brain struggling to receive enough oxygen. Before the final blockage that triggers a stroke, the body often tries to send distress signals. The legs, surprisingly, are among the first to show these signs, because they reveal subtle changes in circulation, balance, sensory processing, and neural control. These changes are not dramatic enough to send someone to the emergency room, but they are clear enough if one knows what to look for. Why the legs? They are the farthest parts of the body from the heart, and they have to fight gravity for blood to return upward. This makes them extremely sensitive to changes in circulation. If blood flow becomes sluggish, the legs are among the first to express difficulty. Imagine a tall apartment building. When water pressure weakens, the highest floors suffer first. The human body works in a similar way. Legs are like the top floors. They tell us early when the system is struggling. Another reason why stroke symptoms show up in the legs first is the way the brain controls the body. The left side of the brain controls the right leg, and the right side of the brain controls the left leg. When a stroke begins developing on one side of the brain, the opposite leg may show subtle abnormalities before the more dramatic facial or speech symptoms appear. This crossed wiring of the brain means that noticing unusual changes in one leg can be like discovering a hidden clue before a catastrophe. Let's examine 7 early warning signs in the legs that may appear before a stroke. These signs are not just getting older or being out of shape. They are potentially the body's early alarm, system small signals that can prevent a lifetime of disability if recognized early. 1. Sudden weakness in one leg. One of the earliest and most telling signs is sudden weakness, or instability on one side. People often describe it as a leg that won't listen, collapses unexpectedly, or lacks power. It may occur while climbing stairs, getting out of a chair, or walking on flat ground. Muscle loss from aging tends to weaken both legs and develops gradually. Brain-related weakness is different, sudden, one-sided, and unpredictable. It may come and go or repeat under similar conditions. Each episode is a red flag. 2. Numbness or altered sensation in one leg. People often underestimate sensory changes. They might feel as if they're wearing socks when they are barefoot, walking on cotton, or stepping on pillows. They may have trouble sensing heat, cold, or texture. Peripheral nerve problems usually start at the toes and move upwards slowly, and they worsen with posture or time of day. Brain-related numbness tends to happen abruptly, on one side and unrelated to positioning. The foot itself may be normal, the brain is misprocessing sensory signals. 3. Dragging one foot or scuffing the ground. Walking is one of the most neurologically complex tasks we perform. The brain must coordinate balance, rhythm, muscle strength, and sensory input simultaneously. When the brain cannot fully activate the muscles responsible for lifting the foot, the toes drag or scuff against the floor. Shoes may wear unevenly, especially at the front edge on one side. Family members often notice this before the individual does. It may appear subtle at first: shortened strides, slower rhythm, or small hesitations during walking. 4. Increased tripping, stumbling, or misjudging steps. Tripping over thresholds, stumbling on flat surfaces, or misjudging stairs are often dismissed as clumsiness. In reality, these incidents can indicate a decline in proprioception, the brain's ability to know where the body is without looking. Just as a malfunctioning GPS leads a car off course, impaired proprioception can cause the brain to miscalculate foot placement. This, combined with reduced reaction speed, makes falls more likely. Falls among older adults are not mild. Accidents, they often trigger a cascade of health decline involving fractures, bed rest, weakened immunity, and reduced mobility. 5. Involuntary leg shaking or movements. When brain signals become irregular or disrupted, involuntary shaking, twitching, or jerking movements may appear. Unlike fatigue-induced tremors, stroke-related movements may persist. occur at rest and lack a clear trigger. The person may feel as though the leg has a mind of its own. These movements are often overlooked or dismissed as nervousness, but the brain may be trying to compensate for a loss of motor coordination beneath the surface. 6. Leaning, swaying, or loss of balance while walking. Balance is not controlled by the legs alone. It is a symphony between the brain, eyes, inner ears, and muscles. When the brain's balance center receives insufficient blood flow, walking becomes unstable. The person may sway, drift to one side, or stagger as if intoxicated. This symptom is especially common in the morning, as blood pressure naturally drops during sleep, reducing cerebral blood flow. Many stroke patients collapse within minutes of waking, because this early imbalance is ignored until it becomes catastrophic. 7. Temporary episodes that disappear and return TIA. The most deceptive warning sign of all is a transient ischemic attack TIA. During a TIA, one leg may become weak or numb for a few minutes to an hour and then recover completely. This temporary improvement tricks many into believing the problem has resolved. In reality, a TIA is often the brain's final warning before a major stroke. Studies show that a significant percentage of individuals who experience a TIA suffer a full stroke within hours or days. The fact that the symptom disappeared does not make it harmless, it makes it urgent. Now that we understand the early signs, the next crucial question is, can stroke be prevented? The answer is encouraging. Many strokes are preventable through lifestyle and vascular management. Controlling blood pressure, blood sugar, and cholesterol reduces the burden on blood vessels. Dietary choices play an important role as well. Foods rich in omega-3 fatty acids, healthy oils, antioxidants, and fiber support vascular health. Fish such as salmon or mackerel, nuts such as walnuts and almonds, olive oil, leafy greens, and berries are among the best options. Exercise does not need to be complicated. Fast walking for 30 minutes a day, 5 days a week improves circulation, lowers inflammation, and strengthens the brain-body connection. The ideal walking pace allows conversation but makes singing difficult. This is a natural intensity guideline. Smoking cessation is critical because smoking damages blood vessels and thickens the blood. Alcohol should be consumed in moderation. Sleep must not be neglected. Chronic sleep deprivation raises both blood pressure and blood sugar, creating the perfect storm for stroke risk. A quick home assessment can offer valuable clues. Try standing up from a chair with arms crossed and notice whether both legs push equally. With eyes closed, stand still for 30 seconds and observe balance. Compare sensations on both feet with touch or temperature. Walk along an imaginary straight line and monitor whether the body sways or missteps. If any of these feel unusual, the body may be signaling a neurological issue. The body rarely lies, it simply speaks quietly. The most important message is, this small warnings prevent big regrets. The legs are not merely tools for movement. They are an early language of the brain. They tell us when something is wrong long before the face, droops, or speech slurs. Sharing this knowledge can protect not only yourself but someone you care about. Health does not begin with fear, it begins with awareness, observation, and action.